Hello and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for May 20th, 2020. Thank you for joining us this month. Our presenter today is Lindsay DiStefano. Dr. DiStefano is the department head and an associate professor in the Department of Kinesiology at the University of Connecticut. She has affiliate appointments in the Department of Public Health Sciences and the Department of Orthopaedic Surgery in the UConn School of Medicine. Dr. DiStefano is extremely active with conducting research to determine the best strategies to promote physical literacy and reduce the risk of youth sports-related injuries such as ACL injuries in children. Dr. DiStefano has published numerous research papers and presented nationally and internationally. She is currently engaged with major research studies to identify best practices for implementation and dissemination of interventions to improve safe physical activity participation and ensure proper development of physical literacy in children. Dr. DiStefano completed her undergraduate degree at Boston University and her graduate and doctoral degrees at the University of North Carolina at Chapel Hill. She resides in Mansfield, Connecticut, with her husband and their 3 children. Dr. DiStefano's talk today is entitled Remain in the Game, a Joint Effort Injury Prevention Toolkit.
Great, thanks so much. Is my sound okay?
Sounds great.
Awesome. All right, well, thank you all for attending today. I am super excited to present this webinar today to you all because I think it is a reflection of a lot of really hard work being done across the world, honestly, for the past 20 years to promote injury prevention and really the impact of primary prevention on lower extremity injuries. And I am super grateful for the work of the Osteoarthritis Action Alliance for their support and motivation towards really getting all of this information and knowledge out over the past several years. So first, as I begin, I just need to quickly say that I don't have any disclosures or financial sort of conflicts of interest with giving this presentation. And also, I really want to make sure that I have a shout out to other injury prevention task force members of the OAAA that were vital and instrumental to contributing to the Remain in the Game sort of toolkit and all the resources that have been developed. So Tom Trojan, Cynthia Labella, Jeff Dreeben, Haley Root, Christine Nisler, Yvonne Golightly, Monette Williams, and Allison Albright. And all of those collaborators are listed on the Remain in the Game Joint Efforts website as well. All right. So as we begin, you know, I'm always reminded by this quote of an ounce of prevention is worth a pound of cure. And when we're discussing and considering osteoarthritis and promoting physical activity across a lifetime, you know, I think it really comes back to what are we doing for primary prevention and really reducing the risk of those initial injuries from occurring. All right, so as we dig into the literature, so what is the evidence about can we prevent ACL injuries, knee injuries, other non-contact injuries that occur during sport? We see that there's been a ton of literature that suggests that yes, we can actually reduce these injury rates, but we also see that there have been a number of studies and that have actually shown that there is no effect with injury prevention program, preventive training programs, including one study that was just published a little bit less than a year ago coming out of Vermont, suggesting that they are not effective. So what is the truth? Well, I like to think about it, injury prevention programs similar to other health behaviors that clinicians really struggle to change health behavior choices being made by individuals. So just like, you know, taking and being compliant with taking daily medication, vitamins, exercising, not smoking, you know, at the end of the day, an intervention is only as effective if the compliance is there. So are people actually doing the prescribed intervention? And that's exactly what we see when we look at primary injury prevention. Okay, so this is a slide adapted from Dai Sugimoto, which is from his publication in 2012, looking at the dose-response relationship of injury prevention programs and the effect on injury rate reduction. And as we see here, so this is from a meta-analysis, so pooled together sort of all of the literature that had been published in, before 2012. And we see that there was a much greater reduction in injury rates when the interventions are performed with high compliance, when they're performed, on a regular basis as prescribed with high fidelity and compliance. Versus when there's moderate or low compliance, we actually see sort of a negligible effect. And that's exactly like what has been reported in that most recent study from Slaughterback and the Vermont group, is that while they showed that the FIFA 11 program did not have a reduction in injury rates in high school athletes, they saw low compliance and adoption. So when we take all of the evidence out there together and we really examine, sort of the highest quality studies where they have demonstrated high compliance and adoption of these programs, we see consistently that we can exhibit a reduction of up to 85% of non-contact lower extremity injuries, ACL injuries included. And this is across the board of different sport populations. So youth and high school female soccer, obviously one of the most commonly studied populations given their risk of ACL injury, but also including male sports, including collegiate male and female soccer. So we see that regardless of the population, these programs definitely seem to be making an impact when they are performed with high compliance, and they certainly do not appear to be causing harm, which is also really important when we think about delivering any type of intervention. And then furthermore, by preventing or reducing the rates of injuries, we also can make a significant impact on healthcare costs, which now is, continues to be a huge need for our public health in our nation and our globe, honestly. All right, so how can we promote compliance? And this seems to be the biggest sort of question. We know that the programs can be effective if they're done well. So how do we get people to do them? And just like other health behaviors, it's not as simple as just telling somebody, I want you to do a preventive training program. We know that does not work. All right, so when we think about what do we actually do need to do to improve adoption and compliance of these programs, we first need to make sure that we're talking about the same thing. So what is in a neuromuscular training program, a preventive training program, or an injury prevention? All of those types of terms have been used to describe essentially the same thing. In my experience, honestly, while I believe that consistent terminology is important, I also believe that we need to make sure that our messages are tailored to the audience. And so for some stakeholders, injury prevention is definitely sort of the phrase to use. But we also have seen directly through personal experience delivering these types of programs, some sort of hang up on the fact that, we want to be careful in saying we're not going to be able to prevent every single injury, but I feel very confident that we can reduce injury. And so the recent NATA position statement, for example, we decided to move forward with it with preventive training program. And so that's what I think, a lot of sort of the resources being developed are using. But in general, when we look at these programs, there are a lot of consistencies across the board in the literature. And as we continue our discussion today, we're going to highlight what appears to be really the common and most critical elements in an injury prevention program. So bottom line is it's an exercise-based program. It's a multifaceted program, meaning that it's consisting of different modes of exercise. So plyometric, balance, strengthening primarily, but then also the inclusion of agility exercise, flexibility exercises really seem important to get buy-in from many coaches and athletes. And then the other critical element is that high movement quality is emphasized and good instruction and feedback are provided to athletes when performing these programs, right? So it's looking at that perfect practice. If you perform the programs with poor quality, then likely the program is not going to make an impact on those neuromuscular control risk factors. But at the end of the day, all of the evidence continues to demonstrate that there does not appear to be any top secret recipe. Okay, so right now the evidence does not show that one specific program is better than another, but rather programs that are designed that include these general criteria can be effective. And from our perspective, I think that's like the best case scenario, because what we've learned through a lot of different health behavior changes is we must meet the audience. We must be able to meet the stakeholders' needs, perceptions, and desires if we are going to gain their change in human behavior. So here's a couple examples of specific programs that I've had the pleasure to work with in different populations. And you can see sort of how we've been able to tailor these programs to meet the needs of the population we're working with. So this is an example program that we used at the United States Military Academy with their incoming freshmen. And this program had to be done in a stationary position. Meanwhile, this is an example program that I've used a lot with AAU, adolescent girls basketball teams. Okay, so similar elements, the design and the specific exercises are just slightly tweaked. And then this is an example program coming out of UNC Chapel Hill that was used with elite youth soccer athletes. Again, similar components, just a little bit different design. And these elements are supported by our recent NATA position statement that I had the pleasure of co-writing with Darren Padua and many other collaborators, which basically, again, sort of highlighted that the number one recommendation is that multi-component training programs that include feedback regarding movement quality and at least 3 exercise categories, strength, plyometrics, agility, balance, and flexibility, are rated to reduce ACL injuries. And that's supported by guidelines that the Osteoarthritis Action Alliance, again, which I was a part of, as well as many other sort of co-collaborators, also came up with by evaluating the evidence out there. So this was published about 2 years after the position statement, and again, highlights the need for plyometric core and lower extremity strength exercises, balance, likely also including agility and flexibility to adapt to the stakeholders' sort of perceptions of what makes an effective warm-up, include movement quality feedback, and make sure that we're attending to compliance. So in order to sort of give us a process that those of us who are actually sort of right in the grassroots of trying to get athletes, coaches, administrators to adopt these programs, Darren Padua and I and a couple other collaborators developed this 7-step dissemination and implementation process, which we published in 2015. And it's a 7-step process used to guide individuals on how to get buy-in, basically, and how to develop an evidence-based program that has a high likelihood to be implemented. Okay, so basically starting at establishing administrative support all the way to identifying barriers, developing, sort of tweaking, modifying a program, training the end-all users, and then maintaining the program use over time. And so the big thing is when we think about like where our society is and what we can do to see across different sport organizations and teams, is that when I think back to 25 years ago when I was a high school athlete, our typical warm-up strategy was running a couple laps around the field, sitting in a circle, doing static stretches. We've seen progressions to that nowadays. I think the most common warm-up activities you see in most sporting events, including youth sport organizations, is a dynamic warm-up. Now, these dynamic warm-ups typically only include agility and flexibility exercises. But when we think about trying to get somebody to change a health behavior, recognizing that they're already doing a dynamic warm-up likely is going to help us progress to making sure that that dynamic warm-up includes evidence-based principles that have been shown to be effective with reducing injury rates. So when we look at the 7 steps and sort of how we can actually implement it in whatever organization that you're potentially working with or talking with, steps 1 and 2 is basically get buy-in from everybody at the table, right? Get everybody at the table, get their opinions, get their input, get their feedback, get their concerns addressed. And that's really going to help sort of engage with all different levels of stakeholders and make sure that the program that is at the end of the day implemented at your setting meets the needs of everybody, which will hopefully guide long-term adoption. And then we need to identify the barriers and solutions, again, that are unique to each individual setting. Yes, I definitely can say that there are some barriers and solutions that seem to be universal, but there are going to be things that change as we talk about sort of a collegiate setting to a youth sport, community team that's led by parents, for example. So in general, we've been able to identify 4 main areas of where these barriers tend to be. So time, personnel, the environment, and the organization. So specifically, what matters to the organization and what are they currently doing? How long is the program going to take each day? And how long does it need to be performed in order to see effect? The personnel, who do you have to work with to actually get the athletes to do the program? And then the environment. What's your location, access to equipment? The nice thing is most of these programs do not require any equipment. So one common sort of barrier that I frequently hear from coaches especially is they want to make sure that the dynamic warm-up program or the injury prevention program that we're trying to guide implementation of is not going to negatively impact their athletes' performance, right? Either acutely or over the long term. And again, a lot of the literature from the strength and conditioning and sport performance literature would suggest absolutely not. There's no evidence that a dynamic warm-up will have any negative effect in the short term or the long term. And if anything, if the load is high enough, you actually might see improvements. But biggest concern is these programs do not appear to harm performance and likely actually promote a warm-up, just like any dynamic warm-up, to have the athletes be more ready to compete. From a time standpoint, this was a really fun study, just a quick survey we did with Connecticut youth soccer and basketball girl coaches a few years ago, and we just asked them a survey of, would you be willing to implement an injury prevention warm-up with your team if the program lasted 30 minutes, 20 minutes, 15 minutes, 10 minutes, and 5 minutes? And you'll see that when we said, would you be willing to perform a 30-minute program, only 20% of the coaches said yes, they were willing. But when we said it was a 15-minute program, now we sort of saw 50-50. But when it came down to 10 minutes, nearly 80% of coaches said that they would be willing to implement an injury prevention warm-up. Now, this is really important because, there seems to be this, and this has also been reflected in some pieces of literature and talking with other individuals across the world, honestly, that a lot of coaches perceive this 10-minute threshold as being a critical thing. Anything above that, they start to get sort of wary that they might not have enough time to really do. So with that in mind, we've really tried to highlight within the Remain in the Game, a joint effort toolkit, what can 10 minutes prevent? Just 10 minutes a day, can really make an impact if performed on a regular basis. Now that's per day. We also need to think about what's the duration over time. And this data is from, it was published by Mickelbust in British Journal of Sports Medicine in 2013, and it's a reflection of what actually happened with Norwegian handball. And so what happened was investigators saw that there was high risk of ACL injury in the late 90s. And because of that, they started implementing an ACL injury prevention program, again, a neuromuscular training program with handball athletes. And what they saw was a rapid decline in injury rates with the program. They felt great about it, they published the evidence, and they moved on. Once the research study was over, the injury rates quickly returned and actually exceeded that baseline level. So it said to them, the benefits of the programs were not retained over time, right? So just like a daily vitamin, it only lasts when you are doing it. So in response to these increase in injury rates, they launched a national campaign to promote injury prevention programs. And now they have seen sort of this sustained decline in injury rates. So at the end of the day, I think what our message should be to athletes and coaches is you're adopting a new type of practice and competition strategy. It's not a, season thing. It's your daily vitamin. Just like, I show UConn women's basketball, known to be a very successful team and organization, but you still see every single day those athletes are out there shooting 100 follow shots a day. They're quite good at being successful with those shots. It doesn't mean that they stop practicing. And that needs to be the message that we give our athletes and coaches. Relative advantage. The other thing we hear a lot is, oh, I'm already doing that. Okay, and so sitting down and working with your stakeholders to identify what are they already doing in their warm-up, if they are doing a dynamic warm-up, right? We know that if they're already doing a dynamic warm-up, that's half the battle. So if you take a look at what they're already doing and realize, okay, what are they missing in their dynamic warm-up in order for it to be an evidence-based program to reduce injury rates, you can make just some small modifications to what they're already doing. And that likely will greatly improve the long-term adoption of the program. So with that in mind, again, addressing the barriers and developing the program that you need to implement. So this is a video, oops, go back. So again, we worked at the United States Military Academy for many years to help them implement a dynamic warm-up. Now, this was a unique setting because they had to develop the program so that it could be performed by over 1,000 new cadets in one location, meaning they couldn't move. All the exercises had to be done in a stationary position. And we were able to do that. We were still able to make the program evidence-based. So know your stakeholders, know the barriers, and then just modify the program as needed. So this is just a highlight of, furthermore, sort of what we've been working on for the Remain in the Game website, and this video is located there as well as on YouTube. So the goal of this website and this toolkit is to make all of these resources as easy as possible to reach all of the athletes in our country and beyond. And just make it as user-friendly and help stakeholders be able to modify those programs so that it meets the needs of each individual team and organization, population that people might interact with. So we've created a library of resources of exercises. You can see here all the videos. And to really just, again, hopefully make it easy. Because we know if we make it easy, again, also hopefully more people are likely to buy in and adopt the programs. And so we hope that this resource and toolkit will further promote these efforts for primary prevention. Once we develop the program, we also need to be conscious of ensuring that the people who are really going to be the stakeholders responsible for implementing the program feel confident. One of the biggest barriers from an implementation perspective is, the parent volunteer coach, for example, who says, I'm not sure that I can, model these exercises, or, I don't know that I'm qualified. So there's some really cool tools that you can use to try to build confidence in that coach or in that team captain even, so that they feel like they can implement the program. So again, working with West Point, we had to teach, juniors and seniors at West Point to be implementers. So we developed just some, quick videos. Again, you could do this live and just say, tell me what I'm doing wrong. The biggest thing is to try to give people confidence that they could recognize a poor movement error and give somebody feedback to correct it. As long as they understand that over time, constant feedback is going to be important. People usually cannot make these changes in movement quality overnight. We also developed sort of like, quick check marks that like a school administrator or an athletic trainer might be able to use, if they're able to just check in periodically to see how the program is being implemented. And again, giving that feedback, right? Just the same reason, as you take a class, you get grades, although it might give you stress at the end of the day, it's a good check mark and reassurance, hopefully, that you're doing a good job. And then again, going back to the dosage thing, I think the messaging just really needs to be important, that this is a new way to participate in sport, right? This is not looking at a date on the calendar to say this is when the program's going to end. This is what people are going to do from here on out prior to sport participation. So again, just to review this 7-step process, I hope it's helpful for people when you're thinking about, okay, now we have the evidence these programs can be effective. We know that the biggest barrier is just getting people to use the program. So how can we improve and promote the use of these programs? Well, think about these 7 steps. Getting input from the stakeholders, identifying the barriers and solutions, developing, modifying, revising a current dynamic warm-up just to be evidence-based. And again, you've got a ton of resources available, including the Remain in the Game toolkit that we've been working on. And I think a lot more sort of resources will be available soon. And then, just thinking about what am I doing to support people if I'm not the one actually implementing, but I'm guiding the implementation. What can I do to help support the implementation? And so with that, I think we will hopefully be able to take some questions and, have a good discussion. I hope this was helpful.
That was great. Thank you so much for that presentation, Dr. DiStefano. I just invite anyone who has questions for our presenter today to go ahead and type those into the chat box. And I have put the URL for the Remain in the Game toolkit in the chat box, and that will be sent out in a follow-up email to everyone who registered today. Dr. DiStefano, I know this may be kind of a large question that we may not have time to go into very extensively, but I wonder if you could just say a little bit about how the COVID-19 situation might affect the need for injury prevention programs when things get back in action.
Oh, that's a fantastic question. And something that I think is really concerning to sort of, I think everybody in sport, definitely everyone in sports medicine, is thinking about what are athletes currently doing to maintain fitness, maintain neuromuscular control, and what do we need to set up to sort of rebuild anything lost before they return to really dynamic activities. I think talking with a bunch of coaches recently, the big concern is, while especially at the collegiate level and high school level, I think a lot of athletes are maintaining some level of fitness, but it's the unanticipated, the dynamic, the explosive movements that are most concerning. And so I think, doing whatever we can to disseminate these programs, encourage athletes to be doing these dynamic warm-ups before they go out for a run, for example, before they're doing any of their exercises, anything that they're doing to stay in shape, would be a great, strategy. Obviously, I think, being a realist, I think, again, your compliance is probably only going to be around 20 to 30%, but, maybe we can be more optimistic. But I think it's really important that we use this time to, sort of arm up and prepare coaches or sport organizations to understand where the resources are, the need to really develop and implement these programs when athletes do return, and to give a period of time to be using these types of programs and above and beyond before athletes really, move into fast acceleration, deceleration, changing direction, unanticipated sort of situations occur.
So definitely even more, there's more importance for getting these programs in place when teams get back on the field. So you mentioned a little bit of about buy-in early on, and I was just wondering maybe specifically for the youth themselves, how you might frame these programs to get them to do it either on their own or as a team. How do you make them see the importance?
Yeah, that's a good question. Well, so I have two points to that. One is I think it's really important to talk to kids. I've implemented a lot of programs with kids as young as 8 years old, and just like it's good to sit down at the table with adult sort of stakeholders that are invested in these programs, or the end users. I think kids have a perception, and I think you really need to make sure that how you're talking to them is going to meet their own sort of understanding. And I say that because we were working with about 30 youth soccer boys and girls teams. And, we had figured out that, ways to keep the program really fun and, just have fun with it. And the kids loved it. And they saw some high school teams in the area doing similar types of programs. And so that's, really attractive to them. But specifically, we were working with a group of 10-year-old boys. And when I started sort of introducing the program to them, a little boy raised his hand and he said, I don't understand why we're doing this program. You mentioned ACL injuries, but ACL injuries are a girl injury and we're boys. So I don't think we need to do this. And that just stopped me in my tracks. I mean, this was 10 years ago now, that a 10-year-old boy already had sort of this misperception that boys are not at risk for ACL injury, when we know actually there are more ACL injuries that occur to boys than girls. Yes, girls have a higher risk, but boys are not immune to this injury. And so I think, it really pays off to make sure that your instructions, the way you introduce the program, the needs are addressing sort of your end user, and allow them to give feedback. We also have found, we incorporating a lot of variety, especially with the younger athletes. They sort of get bored, they get more excited when you change things up, making sure that you address sort of perception of their own confidence and ability to perform, so I found like sometimes I'll purposely make a mistake and say, pretend like, oh yeah, we all make mistakes right now. We're all getting stronger. And as you get stronger, sometimes, you might move differently, but it's okay. We all get better as we practice, and just trying to normalize that so you don't have that barrier. So, I think all the regular things when working with kids apply, and honestly, they can be extrapolated to, even adults too. So I think all those are important factors to consider.
And that's really interesting to think about the different levels and even the different genders, the different sports. So really customizing kind of the framework for the specific team or the specific mindsets that may be in place. Looks like we have one question here that we might end with, since we're a little bit past 12:30. Mylin is asking, are there plans to do follow-up qualitative work to see how children, coaches, and athletes are using the toolkit, and how the impact of the toolkit is being measured?
That's also a fantastic question, and something that I definitely think there's going to be a need for. So, if you have the capacity to do so, I definitely, we would love to, collaborate, or, definitely we'll consider and talk with. That's a great idea.
And I know that for the coach's guide that is available on the Remain in the Game website, people do have to fill out a form, just some brief information about their name, their sport, and then it's emailed to them. So that is one way for us to track at least the number of coaches and the types of sports these coaches are in, that are requesting the guides. So we'll wrap it up there. Thank you so much, Dr. DiStefano, for your presentation today, and for everyone joining us. I will just briefly mention that we hope you can join us for next month's webinar. It's going to be on June 24th, and it will be co-hosted by the Osteoarthritis Action Alliance and ORCE's OA Prevention SEPA group. It will feature Drs. Louise Toma and Brian Pietrosimone, and they will be discussing mechanisms for post-traumatic osteoarthritis development, a behavioral and biomechanical case for underloading. So stay tuned for that registration information, and we will end it there. Thank you so much for joining us today.
Thank you.